Hello, welcome back to Dr. Hayatu's medical session. Today, we'll be discussing hydrocephalus. If you've ever wondered about the causes, symptoms, and treatments for this condition, you're in the right place. Don't forget to subscribe to our channel and ring the notification bell to stay updated on our health content. Let's get started. Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid, or CSF, within the ventricles, which are cavities of the brain. This leads to increased intracranial pressure, which can damage brain tissues and cause a variety of neurological symptoms. Hydrocephalus can be classified into several types based on the underlying cause and the age of onset. The main types include congenital hydrocephalus, which is present at birth and is often caused by genetic factors. Common causes include aqueductal stenosis, neural tube defects such as spina bifida, and infections during pregnancy. Acquired hydrocephalus develops after birth and can occur at any age due to injury or disease. Causes include head injuries, brain tumors, hemorrhages or bleeding in the brain, and complications from brain surgery. Communicating or non-obstructive hydrocephalus in this type, CSF flows freely through the ventricles but is either overproduced or inadequately absorbed into the bloodstream. Common causes include subarachnoid hemorrhage and meningitis. Non-communicating or obstructive hydrocephalus occurs when the flow of CSF is blocked along one or more of the narrow pathways connecting the ventricles. Common causes include aqueductal stenosis and tumors. Lastly, normal pressure hydrocephalus typically affects older adults and is characterized by normal CSF pressure. Symptoms often mimic other conditions like Parkinson's disease or Alzheimer's. Common symptoms include gait disturbances, which is basically difficulty walking, urinary incontinence, and cognitive impairment. Now, the symptoms of hydrocephalus can vary by age and the severity of the condition. In infants, for instance, you might notice a rapid increase in head circumference, a bulging or tense soft spot on the top of the head, vomiting, sleepiness, seizures, eyes fixed downward, which is often referred to as sunsetting eyes, and developmental delays. In older children and adults, the symptoms can include headache, nausea and vomiting, blurred or double vision, balance problems, lethargy or drowsiness, changes in personality or behavior, and cognitive difficulties such as memory problems. Diagnosing hydrocephalus typically involves a combination of clinical assessment and imaging studies. A clinical examination might include the measurement of head circumference, especially in infants, and a neurological examination to assess reflexes, muscle strength, coordination, and sensory abilities. Imaging studies used are ultrasound, which is often used in infants as their fontanelles, or soft spots, allow the sound waves to penetrate the skull, magnetic resonance imaging or MRI, which provides detailed images of the brain structures and can identify abnormalities in CSF flow, and computed tomography or CT scan, which can quickly identify enlarged ventricles and other structural abnormalities. Additional tests might include intracranial pressure monitoring to measure the pressure inside the skull, and occasionally a lumbar puncture to measure CSF pressure and analyze the fluid for infections or other conditions. The management of hydrocephalus depends on the underlying cause, severity, and the patient's age. Surgical treatment options include a ventriculoperitoneal shunt, a common treatment where a tube is inserted into the ventricles to divert excess fluid to another part of the body, usually the abdominal cavity, where it can be absorbed. Another surgical option is an endoscopic third ventriculostomy, a procedure that creates an opening in the floor of the third ventricle, allowing CSF to bypass the obstruction and flow towards sites of absorption around the surface of the brain. Medical management might involve the use of acetazolamide and furosemide. These diuretics can be used temporarily to decrease CSF production, along with medications to control symptoms such as headaches or seizures. Supportive care includes physical therapy, occupational therapy, and speech therapy to help with motor skills, balance, and cognitive function. Educational support is crucial for children with developmental delays or learning difficulties, and regular follow-up appointments are necessary to monitor the condition, manage complications, and assess the effectiveness of the treatment. Timely diagnosis and intervention are crucial to prevent long-term neurological damage and improve the quality of life for individuals with hydrocephalus. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.